Collaboration and Leadership Reflection. Dennis Mogambi, Capella University, Nursing FPX 4010. Reading People, Processes, and Organizations in Interprofessional Practice. Dr. Elsie Crownshield, November 2022. Collaboration and Leadership Reflection. Engagement and leadership are crucial for providing high-quality, evidence-based healthcare services. Medical staff, nursing managers, and supervisors must embrace shared decision-making if hospitals' healthcare services are to improve continuously. That is by Casey et al. 2019. Two parts make up my presentation. A description of an interdisciplinary collaboration experience is presented in the first section, showing how it is succeeding and failed in achieving the desired results. The Villa Hospital case stand appearing Clarion Hospital teamwork scenario is described in the second half. The purpose is to discuss how poor cooperation methods contribute to the issue at Villa Healthcare to provide leadership and interdisciplinary best practices that may be useful. Reflection on personal interdisciplinary cooperation experience. I worked with the department caring for the elderly during the previous internship. The change was significantly impacted how I view the importance of interdisciplinary collaboration in improving patient healthcare outcomes. Despite being difficult and complex, working with these people gave me invaluable skills and a great understanding of interprofessional teamwork in healthcare. I understood that interdisciplinary collaboration was necessary to produce the required results and that doing so would be devastating if it were not done. Each participant was assigned a particular task to complete in order to advance the treatment. That is by Fairweather et al. 2017. Disagreements were rare since team members accepted responsibility as we worked together to deliver superior and effective health care for the elderly. The crew knew its explicit roles, respecting them, and avoided meandering. Each individual's importance and participation in the physician's healthcare results were known to us. The team complementary talents and also helped. The team's complementary talents also helped it achieve the desired outcomes in ensuring the public would benefit from it for various conditions. That's by Coulter 2017. Age-related patient conditions include heart problems, hypertension, blindness, deafness, depression, and anxiety. Team members were assigned tasks about patients based on their qualifications and areas of expertise. As a result, patients with various medical conditions received excellent care. A clearer picture was formed at the project's outset, which helped reach the necessary objectives. The ultimate effectiveness was also boosted by effective teamwork. On the other side, it will not attain objectives like patient satisfaction due to its management and relationship issues. The team's diversity exacerbated issues like communication breakdown and divergent perspectives on concepts like team management. I'm excited to help the team in upcoming tasks improve time management and communication skills so we can accomplish our objectives more successfully. Ways poor collaboration and results in inefficient management of human and financial resources. Effective collaboration is one of the essential strategies in healthcare for providing high-quality patient care, improving medical services, bedside manner, and adequate human and physical resources management. However, as shown by Villa Health Care Study, the absence of same leads to inefficiencies in health management on a general level. Ineffective collaboration leads to conflict and resistance to change. That's by Akmal ETAL 2022. The management and the care staff at Vera Health expressed unease and discontent with the rollout of new electronic health information, also known as EHR system health. Due to differences, Vera Medical and the branch were unable to cooperate. The major corporations have turned to use health to help save expenditures. However, the approach did not consider consider other persons impacted by the system because extra stakeholders were not consulted. Despite the well-founded need for transformation, the current method of implementing the change was poor because of lack of engagement. Furthermore, nursing homes were not the planned setting for the usage of health. Since interdisciplinary team could not collaborate to assess how good the system was, they lacked clear direction. The other catastrophe was caused by corporate Josh tasked to implement health. Another illustration of the league's lack of collaboration was this. Josh did not know the facilities and depended solely on information from the personnel, declining to speak with other executives and managers. This exemplifies how inefficient collaboration results in inefficiency across the range of tasks, including executing change. Additionally, because staff members do not obtain enough system training, it inhibits staff growth. Therefore, it will be challenged to use it to finish the prescribed task without sufficient training. Best practice leadership strategies from the literature that would improve an interdisciplinary team's ability to achieve its goals. The team's leadership strategies impact how well an interdisciplinary team achieves its objectives. Making and carrying out a great communication plan is one way to improve the capacity to achieve goals. The case study has shown Else Wang, the clinic's end of operations, how crucial good communication and coordination are in the health sector. However, throughout the health implementation phase, it became clear that facility lacked effective teamwork and communication. Due to poor communication, the staff cannot understand the change impact. It would have been simpler to convince the staff of the need for the change and help them accept it throughout training with verbal teamwork, as planned, as by Pearson ETAL 2017. Employee motivation and enjoyment would have increased, and this would have been reflected in their work. Furthermore, effective communication would have enabled all staff members and stakeholders to participate in decision making and offer critical input to the change. Furthermore, due to lack of an effective communication plan, the branch facility could not oppose the new system installation even though it was inappropriate with their services. Because corporate Josh lacked solid communication strategy, they could not implement the change. Vera Health employees worries about the system viability and usefulness were not addressed, which led to broad and orange chasm between the two groups. Therefore, respect and understanding promote coherence within this team. Motivating members to work together towards shared targets and goals. The outcome and Vera Health would have been different if just corporate and demonstrated more respect and inclusivity to gain the other employees' understanding. Conclusion. Furthermore, effective communication would have enabled all staff members and stakeholders to participate in decision making and offer critical input to the change. Furthermore, due to lack of an effective communication plan, the branch facility could not oppose the new system installation even though it was inappropriate with their services. Because Corporate Josh lacked a solid communication strategy, they would not implement the change. Villa Health employees' worries about the system's viability and usefulness were not addressed, which led to broad knowledge chasm between the two groups. Therefore, respect and understanding promote coherence within this team, motivating members to work together towards shared targets and goals. Villa Health is an example of an interdisciplinary team that may improve its ability to achieve goals and work together more productively with effective communication strategies, respect, and understanding.